and welcome, listeners. You are tuned in to Radio Zindagi 1170 AM, and this is the perfect time for talking logics. Why would I say that? Because we are back with yet another episode of Illuminating Mind Matters with BASANT. BASANT, which stands for Bay Area South Asian Network of Therapists. It is a non-profit organization raising awareness and advocating for mental health issues that affects the South Asian community. We help the community members with educational resources and help them connect with culturally competent mental health professionals. So, with that, we get guests, we get very important members from the community to answer the questions from the community as well. And I would like to remind all our listeners that if you have anything specific in your mind which you would like us to discuss on our show, you have to write us on info@basantnow.org. That is info@basantnow.org. If you would like to know more about Basant, you can just log on to basantnow.org. That would be their website, or just give them a call 510-770-6223. And the host for our show is Shalini Dayal, who is a marriage family therapist. Over to you, Shalini.
Thank you, Vedika, for the wonderful introduction. And welcome, listeners, to another episode of Illuminating Mind Matters with Basant Now at Radio Zindagi. I am Shalini, and I'm my host today. And today's topic is mental health and pediatrics. And with me, I'm very honored to have Dr. Halij-pour, who is a pediatrician, on our show today. Dr. Halij-pour was born in Greenville, Texas, and is of Iranian descent. He completed his undergraduate degree at UC Davis and received his medical degree from Drexel University in Philadelphia. He chose pediatrics because he had the most fun on his rotations in medical school. He did 3 years of pediatric training at Miami Children's Hospital, and now is a practicing pediatrician in Fremont at the Southeast Bay Pediatrics for the last 13 years. Most importantly, he's the parent of 2 kids, a 16 and a 10-year-old. So welcome, Dr. Halij-pour, and thank you for taking time from your very busy schedule to join us.
Mhm.
And today's topic, we are going to be discussing and would like your thoughts on the mental health challenges that our kids and teens face in our community. So my first question is, often as the frontline physician working with kids and teens, what do you see are the mental health challenges that they face in our community these days?
Well, thank you for having me, Shalini, and hi to your listener and to your potential viewers. It's an honor to be here, and again, thanks for having me. The challenges that I see for my teams, if we specifically talk about mental health challenges, especially in 2021, even if we put the pandemic aside for just a second, I mean, that by itself is a huge undertaking. We can talk probably hours about that. But is the pressure that they are growing and thriving under in our society, from social media to socializing at school to not having any privacy to the academic pressures that are put on, compared to you when we went through. And granted, you're much younger, but ours was maybe a bit ago. I mean, the pressure on them is tremendous, and dealing with all of those, satisfying us demanding parents, and living a healthy social life. I mean, that combination when you're 14 is tremendously stressful. So if I have to pick 2, in my opinion, for my teens that I see, is the academic pressure, and probably social media. There are many, many more, and every kid's situation is a bit different. But those two are really big.
And thank you for sharing that, Dr. Halij-pour, because I agree with you that social media and the academic pressures are a big challenge for our teens these days. How do you see in your practice every day seeing kids and teens? How are they manifesting these pressures that bring them to your office?
So the easy cases are, the kids who, just exhibit symptoms of sadness for a long time. They're completely
Mhm.
regressed. They they express obvious sadness in their facial
Mhm.
features, in their conversation. Those are the easy cases. But the difficult one are the one that they're not as obvious. It's the kid who is very smart, who's very compassionate, who's under a lot of stress and a lot of pressure. Doesn't want to disappoint parents. He's taking it all in, and then there's so much that they can take in, and those are the hard ones to pick up. And it's hard to pick them before it's too late. Just speaking practically for parents to get something out of it, any chronic changes in behavior or changes that are consistent, let's not put it chronic. So grades that are dropping, that's not usual for my child, and they're not coming back up. We all have a bad day, we all bomb a test here and there, but then you spring right back up. But consistent issue with academics, you know changing of demeanors, being quieter than usual, being to themselves more, being in a room more, and differentiating that from the kid who wants privacy. Not all kids who want to be in a room, they have depression, anxiety, or mental health issue, but different from the norm, different what has been a baseline a little bit. The tone of the conversation, the facial features, their affects, those are some of the smaller issues and things that parents can pick on, that they could indicate and they can point to it. But again, I want to also make sure I don't stress parents out too much. Teenagers sometimes, especially maybe ladies before their periods, they can have a couple of days of not feeling good and being a little bit sad or not happy. And then as long as they spring back up and they're good the next week, you're okay. A teenager getting into an argument with a friend for a week, not feeling good, and bouncing back up 2 weeks later, you don't have to worry about it. But again, once you see a pattern, once you see something that keeps dragging for a bit, if in doubt and if you're not sure, just bring it up, ask, email us, talk to us, call us. If in doubt, take the cautious side, because it's not easy. In the US, I think, and don't quote me on the numbers, about 10 to 15% of teenagers, they suffer from some kind of mental health issue.
Mhm.
But those are the ones who are diagnosed. That number is a whole lot larger for the kids who go throughout their teen years, throughout their adulthood, and they're not getting diagnosed. And we always think it's the kids. It's never my kid. Is the neighbor's kid, or it's a kid that I hear on social media. But common things are common, unfortunately.
You bring up some really important topics about anxiety and depression. And I think you touched on what my next question was going to be about. What do you see that causes you concern when, whether it's the obvious signs or the non-obvious signs, for the child who's functioning really well, but is not always upfront. And so when they come into your practice, because the families are seeing some changes in their normal behaviors, what are you looking for?
So this is a really good question, especially for parents, because I really want
Mm-hmm.
parents to understand us as pediatrician,
Mm-hmm.
what we're supposed to do, what we do. We have about 20 minutes to do a physical, and if we're
Mm-hmm.
lucky, and in that 20 minutes, we have to address so many issues, from their oral hygiene to their vital signs to their school, to examining them, to talk about their diet, to talk about reading habits. And then if you want to add mental health and screening, that
Mm-hmm.
we have to really make the most out of that time. And in a few minutes that we can really dedicate to that, we may not always be successful at diagnosing it. So we really rely on parents, on what they tell us, to really make the diagnosis as well. So we have these questionnaires that they are standardized, they're proven by research that it works. So we have parents do that, make our job a little easier. For a teenager, we talk to them alone after a certain age, and we run those questions. Is there anything I need to worry about? So we try to elicit some of those feelings and information from them, and building that trust over time. That's helpful. If I'm seeing you for the first time, sometimes that may not happen the first visit or two. And then, the things that we see in the office, their affect, the way they behave, the way they talk, the tone of their voice, and of course, questioning about the grades. And so we try our best, but you have to realize in that short period of time, it's not an easy thing to do. And I want parents to be aware of that. So parents are going to have to be the best advocate for their kids. So if they see something they're not sure, if they see something that's worrisome, I really encourage them to ask. It doesn't hurt. I think you're much safer asking, and then for it to be wrong, to be a concern that you handle, than to miss it and not bothered by it. So again, for us in the office, again, is when I ask about the grades are dropping and there's no obvious reason for it. Their facial affect, their the way they interact with me, the way they interact with their parents sometimes, the questioning like I mentioned. And then in the private conversation we have for our kids who are 14 and 15 and above, try to listen. So this is, very confidential. I'm only here to educate you. I'm not here to tell you what to do. So if there's something I can help, this is your time. So these areas that we get a chance to talk to them and try to get that information. And as much as I want to think I'm pretty good at, successful at it, most of us pediatrician, but again, we miss a lot. Whether we want to agree to it or not, or admit to it or not, it's difficult in that 20 minutes to cover so many things. And so again, parents, best advocate for the kids, and please ask us. I know we can direct you to the proper venue if there is a concern, if there's an issue.
And thank you for pointing it out, that how crucial the role of the parent is to share that information and feedback on what they're seeing with their children with you. So that will help you also determine what is going on, because you're right, in those 20 minutes, and sometimes even shorter for a sick visit, I mean, you have to go through so many patients. All the information we can give to you is very helpful. Vedika, as a parent as well, I mean, what are you hearing? And we would love to hear your thoughts and questions for Dr. Ali.
So actually, when Dr. Ali covered that part, that parents have to be in a balanced position, like not too much looking for signs and not ignoring them as well. That actually is very important, which I see even around me. So thank you, Dr. Ali, for covering that point, and really what we should look for. And it's so important, because the parents can be doctor's warrior. So the doctor has to be fighting alone. The parents can be a big help in that sense. And I think our community needs to keep that in mind. And if we are talking about something needs to be kept in mind, listeners, I would like to remind you that you're listening to Illuminating Mind Matters with BASANT. And the most important thing which I would like to highlight is, if you want something to discuss on our show, just like this very important topic, do write us on info@basantnow.org, or just log on to the website basantnow.org, or just the number, which is 510-770-6223. And we bring this show every Wednesday, so you can keep tuned every Wednesday. Great topic. So Shalini, I think let me not stop you from this, and let's Dr. Ali continue.
Thank you, Vedika. I appreciate it, and for sharing that information about our organization as well. Dr. Halij-pour, how do you address concerns with parents, especially in situations where there is a lot of myth and misconception about anxiety and depression with kids and teens?
That's a very challenging part. Very challenging, because they have their own set of preconception. We were from a generation that we were raised differently, and due to nothing wrong to our parents back then, that was the norm. And then some of these beliefs and this thinking persist. And going through these conversations with parents who may not be as, I don't want to say open-minded, because they are open-minded, but their system of belief may be different than maybe mine. Mm-hmm. It's not always the easy conversation. Part of it is the trust we build as primary care doctors, making sure that we let them know by our action, by what I say, is I'm here not to tell you what to do. I'm here to give you information to do what's the best for your child, and building that trust. So making sure if I say something and if you don't like it, it's not because I'm trying to offend you. I'm just trying to give you the information. What I would do for my own child, I'm telling you that. So building that trust, I think, plays a big role. Luckily, my patient population comes, I'm lucky enough that I live in an area that my patient population, they're fairly educated. So it makes my job a little bit easier because I just can bring them data. They're very data oriented. So the statistics, telling them, look, this is what the numbers are. This is what the research shows. This is some information you can take home and read. Look at this website. Don't look at that website. Opinions are one thing you hear from people, but facts and data is something else. And let them know that, I'm telling you this not because I want to get you out of my hair, but it's because I care for your child. And I'm just building that trust, and then it's not always with one sessions. I have to call sometimes and follow up. How are things? And then just come back in a month or 2 months and let's readdress this. Let's see how things are going. So it's a process. And sometimes we succeed. Sometimes we don't. We want to think that over time, we get to educate and convince eventually what needs to be done. But again, it's not always easy.
And I hear you when you say that, building trust is so important. And so you can help educate the parents and also convince them that you are on their team. You are there for the welfare of their child. So very well said, Dr. Halij-pour.
If you don't mind, Shalini, I want to add one more thing.
Yes,
and again, not trying to make excuses for us pediatrician. Sometimes, given that 20-minute session, and if I pick this up at the end of the visit, and I've already spent my 30 minutes, I went even an extra 10 minutes, and we do feel like we are rushed in these conversations. That's why as pediatricians, we're always behind. Like, you're always waiting in a room for an extra 20 minutes for us to get to you, because it's unpredictable what can come through these doors. And as much as we always spend extra time, or at least we try, it does sometimes give the feeling to parents that we are rushed. We want to do something and go. And sometimes they have millions of questions, and we try to address most, but there is, at some point, we have to draw the line. And I want to make sure parents realize that, if you don't get all your question answered with that visit, call back, reach back out. Sometimes come back again. And again, forget about your pediatrician, your primary care doctor, your counselor, your friend, your coach, your pastor, whoever it is that you're having this conversation. Go back again, and then they want to spend more time, but sometimes it's just because of the situation of that day. It's not always easy. But don't, I'm going to put a plug in for pediatrician. I might be a bit selfish in that regard. Pediatric is the lowest paid job in medicine. People who are in it, they're in it because they really like it. So we really enjoy what we do. But again, because of the constrictive time, sometimes we may look like we're in a rush to go out. But most of us is because we know when we go to the next door, the other person that's waiting for 20 minutes, and they're just going to hate our gut. And then that cycle is going to persist the whole day. So all I'm asking is for them to just call back again, come back again, and we make sure we address it. We don't want to rush it, but we always have to, try to take that balance into consideration, if not having, people wait for an extra half an hour afterward. It's a tricky balance, but I hope it makes sense.
That is, thank you for sharing that. And I'm actually surprised, and I feel bad to hear that pediatrics is the lowest paid, because you are entrusted with the most precious of all parents.
And honestly, it's not just pediatric, it's primary care.
Primary care, yes.
This is family medicine, pediatrics, teachers, counselors. I mean, all these people who spend so much time in trying to prevent, to try to educate, to try to raise our kids. They're totally underpaid, in my opinion.
Yes.
In my opinion, teachers should be paid as much as doctors, if not more. Counselors, the same thing, especially school counselor. I mean, I can rant about
you can talk about that.
An hour, I'm going to stop it. But,
and thank you for mentioning that, and thank you for mentioning that, that how actually it gives us an insight about when you're rushed is because you're trying to answer all the questions and concerns of the parents. So for the parents who are waiting outside, it's like, because there's another parent and another child who also needs your attention. So that's very good to keep in mind. In your clinic and in your practice, when a child is diagnosed with anxiety or depression, how can you support? How do you provide support to your patient and to the family?
So we see ourselves as really educators,
Mm-hmm.
to just provide them things that they can do at the moment.
Mm-hmm.
So depending on the situation, a lot of the time, our biggest focus, and we could have another hour talking about sleep and the importance of sleep. So we have a big conversation about optimizing sleep, and I don't want to go too much into it. We can come back if we have time. Teaching them things that it can, we want to teach them coping skills. And usually we refer them to the counselors because they can do this so much better than we can do. But in a short period of time, we have the importance of physical activity on your health, on your mental health. How, it's one of the few things that can produce free endorphins, which are hormones that makes your brain happy. I'm teaching about meditation, how a 1 or 2 minute meditative practice, not a 30 minutes yoga pose, how effective that can be if you practice it. It only takes a minute, maybe two. About food decisions, about the importance of cutting down on sometimes excessive social media, practices that they can do to calm themselves down. Writing is a great tool that for some kids is so therapeutic. Just put your feeling down on paper, and it's amazing how the flow can be therapeutic for some kids, including adults, honestly. And then we always recommend for them to see also a counselor. Most insurances that cover 20 sessions. The only drawback is the hour you're going to spend. Now a lot of it is done on Zoom, so you don't even have to drive. So
Mm-hmm.
you only benefit from it. It's a better fit hassle to make some phone calls, like get an appointment, but you can only benefit from seeing a counselor. Some parents, they don't want to go with their kid first. It's like, just go by yourself. Just go talk about the things you see and you worry. If you don't want to take your kid first, it's amazing what you can learn as a parent, how it can reinforce the things you do and give you confidence that what you're doing is the correct thing, and then tweak a few things that you could do better. And again, a couple other things, but and I know we're short in time, but basically in the 5-10 minutes or 20 minutes that we have, we try to really emphasize those few things that I mentioned.
Thank you so much for sharing that. And just in the with the thought of time in mind, what are some 3 key points that you can share to our parents who are listening that would help them support their children in these very trying times?
um, I'm gonna go back to sleep. I mean, I
Okay.
cannot
Mm-hmm.
stress. Sleep is the one thing that
Mm-hmm.
is in your hand. That is one
Mm-hmm.
of the few things that affect both your mental health and your physical health.
Mm-hmm.
You don't have control over the genes, a little control over the environment, but sleep you do control. Sleep is
Mm-hmm.
huge. I highly emphasize seeing a counselor, in my opinion, because you can only benefit. If I was the king of the world, and I would want every 12-year-old to see a counselor at 12, just because you can only benefit from it. And if I have to pick one more, is better, be better communicator with your kids. We love
Mm-hmm.
them to pieces, but God, sometimes we're terrible at implementing that love. One of the advice I give, and I think a lot of family like it, is once a month, sit with your kids and talk to them. What can I do better? Or if there is a problem you want to solve, I think ask them. We've been trying. What do you think we should do to solve this problem? Put the ball on their court. It's amazing the solution that will come, and it will work a lot better usually when it comes on their end, when we try as parents to impose them. There are, I think, a couple more things, but that was a great question. I wish I could talk about it a little bit more, but I think those 3 things, I think that can be really helpful.
So we do have a couple of minutes, and so I was wondering if you can talk a little bit about communication with parents, because as a counselor, we talk a lot about listening and listening skills. And so if you can share a little bit of tips, as a pediatrician about communicating and listening skills to your parents, that would be helpful as well.
You're asking the wrong guy. You should be the one giving that advice right now. But
So-
but if I have to put my 2 cents, in
yes.
my humble opinion, what I think works, I think we want to communicate with our parents, I think, the way our parents have communicated with us. That's what I feel, and I hear a lot from my parents. When we were younger, we didn't have this, we didn't have that. A lot of time what works really well for me is when I put my 15-year-old and the mom in a room, and I'm trying to have them put themselves in each other's shoes. So think about if you were at this stage, the things you wanted, and then I get these answers that, my mom didn't let me ever to do that. But I'm like, look, don't give me that answer. Like, what would you have wanted? As a 14-year-old, I know your mom didn't let you, but what would you have wanted? And then also try to have the 14-year-old, 15-year-old in their mom. She's like, when you're going to have a kid, you're going to worry about them. You're going to be always concerned, and you want them to be well. And, and you may not going to express that love. Think about if you have a, 10-year-old brother, how would you, help him? You're going to be a little bit rough sometimes, and you don't mean it, but it's going to come off like that. So trying to put them in each other's shoes for a second and really feel how they feel. And sometimes there's a bit of understanding. And to me, the most valuable thing they can do, parents, is see a therapist. That therapist is a third person, is like a judge who sits there in a very confidential, professional manner, and it helps them communicate better. Instead of talking at each other, it helps them, just give that person a second. Let's see what let's finish the conversation. Let's see what they mean by that.
Yes.
As opposed to just keep going. You already have an answer ready to say before you even absorb and think about what your teenagers, or vice versa. The teen, whatever mom says, doesn't even think about it. They're very defensive. They just walk right away. So
that was good.
I wish there were enough counselors around and people who have time and afford to do it, that everybody would do.
Thank you for your endorsement. I appreciate it very much.
It's the fact,
and your support.
The truth is, it's what helps. It's what works. It's medical fact. It's medical science. That's all there is to it.
Thank you so much for your insight and your valuable tips and your time, Dr. Halij-pour. And I'm going to turn it back to Vedika.
Thank you both of you for bringing yet another show which will benefit our community. And listeners, let me remind you one more time, info@basantnow.org is where you should write if you want any particular topic to be picked on our show. And for a lot of information on Basant, just visit basantnow.org. With that, this is RJ Vedika signing off. We'll see you next Wednesday, 12:30 to 1. Till then, cheers.